Hello friends, welcome back. I'm Dr. TomFletcher of Project Perform. Let's talk about, of course, low back pain. Facet. Let's talk about facet problems. Before we do that, what happened when the limbo, what happened when the limbo champion walked into the bar? He was disqualified, of course. Thank you. And today, they keep getting better and better every time. Today we're going to talk with low back pain. We're going to talk about facet pain. What is a facet or a facet? I mean, who knows? I learned it as facet. So our low back here, these are our vertebrae. This is our facet joint, right there where my finger is. So it's opening and closing there. You can see that open and close. What happens in our low back if we stand, if we're standing or maybe even arching backwards too much? That facet joint gets smashed or crunched. It can get pinched. It can be from an accident, but it can also be from leaning back or just kind of regular posture. It just happens. So what happens if that facet gets smashed too much? Potentially. Oh, how about that bulging? So it doesn't always happen, but we want to prevent that. So anyway, let's do some easy stretches for like a facet or a facet joint area. So it's going to be kind of the opposite of bending forward. So anyway, so here we go. We don't want to stop the jamming, slamming of the facet joint. We want to stop the kind of the pancake or the flat butt stuff. So right away, let's go flat on our back. Excuse me, Herman. So this isn't the easiest one, but if you can imagine, there's a bug underneath my back. Oh, I want to smash that bug, right? He's a nasty bug that's going to bite my kids or something. So I want to smash that bug under my back. So my abdominal wall's got to go down a little bit. I got to try and touch my back to the floor. Of course, this is done better on a harder surface like carpet, but not the best for a mattress or a couch, okay? If this is easy enough for you, or if you want to get interesting, touch the heel to the floor, but just make sure that the lower back continues the contact the floor. I'm talking push the floor with your lower back, okay? We don't want any of this. We don't want any of that arching stuff. That's what caused the facet or the low back pain in the first place, okay? Another easy one for that facet area, kind of a child's pose-ish. I'm going to go a little bit wider with my knees, so it's kind of more of a frog, is what I call it. So here, I push my elbows into the ground, push my knees into the ground, kind of try and bring my knees and my elbows together. Knees and elbows together. So you can see that's going to kind of arch my back or kind of stick my back up, kind of curve my back, maybe like a cat. Maybe like the cat and the cat-cow. But that's going to stretch that facet area, okay? Because we're trying to prevent the sag. We're trying to prevent the sagging stuff, okay? Again, so the frog stretch is a good one. Kind of the dead bug thing and the dead bug moving the legs and arms independently. Those are both going to help. Sometimes it's hard to know if it is a facet or if it is a disc or it is an SI joint. But if you look at the series of our videos, we can help you figure that out. Sometimes it's just general back pain. But anyway, my name's Dr. TomFletcher. If you like it, leave a comment. If you don't like it, go ahead and leave a comment below. Check out our page. If you'd like to, subscribe. Maybe you'll learn something. Anyway, we'll see you next time.